As you know, that mechanical thrombectomy has been introduced for treatment of acute ischemic stroke that's related to occlusion of the internal carotid artery or the middle cerebral artery. And it has been used for basilar artery occlusion, but nonetheless, no conclusive evidence existed that it actually is beneficial. And I think that the need for such evidence became more apparent as people started realizing that perhaps intravenous thrombolysis is efficacious in basilar artery occlusion, and perhaps not all patients with basilar artery occlusion suffer death or disability. In the last few years, 4 trials have been done. And, in the first 2 trials, actually the results were somewhat inconclusive. Part of it, the design issues, part of it, the smaller sample size. But now recently we had 2 large randomized clinical trials that actually looked at basilar artery occlusion patients, but made an effort to actually try to select the patients who are more likely to benefit. And this was actually the test of that hypothesis that if you actually have a carefully selected group of patients with basilar artery occlusion, is mechanical thrombectomy better than best medical treatment, which does actually include intravenous thrombolysis. And both the trials had somewhat of a different design, but what they did was 2 things they did was similar. One, they ensured that patients who have a NIH stroke scale of 10 or greater were included. So they didn't really include patients with mild strokes or stroke that may actually have a good outcome regardless of any intervention. And they also made an effort to exclude patients who actually already had established ischemia on the scan, so on plain CT scan. So they made an effort to select those patients. And essentially, both of the trials actually showed that there was a reduction in death or disability after mechanical thrombectomy. And now there was an opportunity to put all the existing data together to come up with something more conclusive and provide a higher level of precision and estimate. And that's what we did. So we did this meta-analysis and then essentially demonstrated that mechanical thrombectomy in patients with basilar artery occlusion actually does reduce death or disability. And also the risk of intracerebral hemorrhage was not that high. So it really conclusively gives or provides that evidence we needed how to manage patients with basilar artery occlusion. And now we have that evidence. So that's kind of where we are. It's quite possible that the guidelines from the American Stroke Association and the American Heart Association may be updated. So the current guidelines do not have a conclusive recommendation for basilar artery occlusion. On the other hand, an argument can be made since none of the data was actually from United States or Europe. Actually, some of the meta-analysis data did come from Europe, but there's no real trial in North America that has actually evaluated this question. So the problem, of course, is that at this point, perhaps there will be no other trial in North America. I think the evidence has become so strong that it's very unlikely that investigators will randomize patients in North America who have a basilar artery occlusion and meet some of the criteria that were used in the clinical trials. So I think that remains to be seen, that how the guidelines incorporate evidence, because it's unlikely that new evidence will come forward. It's unlikely a new trial will be done. So I think that let's see, it may not make the highest level of recommendation, but I think that probably we will see some form of this evidence being incorporated into the guidelines.